If we start off with, firstly, I want to welcome Mr. LeBlanc and Minister Duclos here and all the staff. We've had a great meeting. You know, this is a positive discussion because we started out on the CHT transfer for some time a while back, and it's great to see it coming to fruition. You know, I'm especially pleased about some of the references in relation to looking at the situation in New Brunswick and in Atlantic Canada, which was recognized in the agreement. So we've got a path forward, and it's a good news story, and I am pleased to welcome you here to the city and welcome to our province. But you're no stranger to the province.
So, Premier, thank you for having Jean-Yves and me this morning in St. John with Bruce Fitch. This is a continuation of some travel that Jean-Yves and I did last week in other jurisdictions. We updated Premier Higgs on some of our positive conversations with his fellow First Ministers. We wanted to be in New Brunswick this morning and Prince Edward Island this afternoon, and we're in Quebec City tomorrow. I have said publicly a number of times, as has the Prime Minister, that Premier Higgs has been, and his government has been, a very constructive partner for us in these conversations around strengthening health care for New Brunswickers and Canadians. Premier Higgs was one of the first premiers to say that he thought sharing data across the healthcare system would be important to improve the quality of care for patients and the accountability for all governments. He has publicly and privately been an ally for our government in these conversations. He was 2 weeks ago when the Prime Minister met the First Ministers in Ottawa, so I wanted to acknowledge that when we had this meeting with Premier Higgs this morning. I think we're close to coming to an agreement in principle which would allow New Brunswick to plan how they'll use these incremental federal dollars. Alors, si vous me permettez, on est content, Jean-Yves et moi, de continuer nos voyages, d'être à Fredericton, d'être à Saint-Jean aujourd'hui, d'être à Saint-Jean avec le Premier ministre Higgs et le ministre Fitch aujourd'hui. Nous avons eu une discussion très positive. Je suis convaincu que le gouvernement du Nouveau-Brunswick et le gouvernement du Canada vont arriver à une entente de principe d'une façon collaborative au cours des prochains jours ou prochaines semaines. Nous avons énormément en commun avec le gouvernement du Nouveau-Brunswick quant à renforcer le système de soins de santé dans cette province. Moi, je suis témoin d'une façon très personnelle de la réussite du système de soins de santé au Nouveau-Brunswick et je suis très encouragé par la discussion avec M. Higgs et M. Fitch ce matin. Et je veux reconnaître aussi que le gouvernement du Nouveau-Brunswick et le Premier ministre Higgs en particulier a été un allié dès le début avec le gouvernement de M. Trudeau, avec notre gouvernement, quant à l'importance, par exemple, de partager des données, de pouvoir comparer des données dans le système de soins de santé d'une juridiction à l'autre, d'augmenter l'imputabilité de tous les gouvernements face à ces investissements massifs de l'argent des contribuables dans le système de soins de santé. Le Premier ministre Higgs et son gouvernement ont été, depuis le début de ces discussions, un partenaire important pour le gouvernement du Canada. Et si nous sommes où on est aujourd'hui, sur le plan national, dans les conversations avec les premiers ministres de d'autres provinces, c'est en partie à cause du travail que M. Higgs a fait au cours des derniers mois et on voulait le souligner aujourd'hui. Jean-Yves, as-tu...
Bien, très bien. Écoutez, c'est évidemment une grande chance que j'ai d'être au Nouveau-Brunswick, dans la province de mon collègue Dominic. On a parlé, comme le dit Dominic, avec le ministre Fitch, le Premier ministre Higgs, des grands domaines de priorité communes qu'on a identifiés déjà plusieurs mois, c'est-à-dire, investir dans un meilleur accès à la médecine familiale ici au Nouveau-Brunswick. 2, prendre soin des travailleurs pour qu'ils puissent prendre soin des patients et réduire les retards en chirurgie et en diagnostic. 3, investir en soins de santé mentale, en particulier pour les plus jeunes Canadiens et Nouveau-Brunswickois. Et 4e, avoir un système de données moderne, parce que les données, ça sauve des vies. Dominique est un exemple de l'importance pour les travailleurs de pouvoir travailler ensemble pour prendre soin des patients en échangeant d'informations davantage entre les fournisseurs, que ce soit les pharmaciens, les chirurgiens, les médecins de famille, les infirmières et les ambulanciers. Donc, un travail important ce matin, mais évidemment, le travail le plus important, c'est pour la suite. On attend prochainement, je crois, une réponse là, qui va indiquer une entente de principe entre les deux gouvernements pour que ensuite la province puisse, avec le leadership du ministre Fitch et de son équipe, développer un plan d'action qui va indiquer aux gens de la province du Nouveau-Brunswick comment ces dollars du gouvernement canadien pourront servir à améliorer la qualité des soins dans la province. So in English, I would say that I'm very pleased, obviously, to be in the wonderful province of New Brunswick with my colleague Dominic. We spoke about the 4 areas of shared priorities that Minister Fitch and other ministers of health in the country developed over the last years, which is better access to family medicine, which is key to have a well-functioning healthcare system in this province and elsewhere, supporting workers so they can support patients and reduce backlogs, investing in mental health, timely and appropriate mental health care services for young and younger Canadians in particular, and finally, because data saves lives, making sure we have a more modern health care system where workers can work better together to look after the health and safety of people. The next step is for the province to indicate its agreement in principle, and then we can work together to help Minister Fitch and his team to implement those incremental dollars in a manner which is supportive of the healthcare needs of people in this province.
Mr. Fitch?
Well, thanks very much, and it was a great meeting this morning. I'd like to welcome the 2 ministers to New Brunswick and thank them for their time this morning. And again, the agreement in principle is something that we can move forward on. I will be communicating that in writing to the minister, and then we'll allow the staff to coordinate the plans. And we're in accord with respect to the goals that the federal government have set out, such as reducing wait times, having access to mental health and addiction services, making sure that we're connected and we can collect data and improve the outcomes for our healthcare system, and again, making sure that primary care is available to people here in the province of New Brunswick, which will alleviate some of the problems, some of the backup within the emergency rooms. And we talked about some other items that, again, we'll be working on, such as immigration of healthcare workers and trying to expedite some of that to have the credentials that we've already spoken on before. Donc, en français, je suis très contente avec la rencontre aujourd'hui et je vous dis bienvenue et merci pour les 2 ministères fédéraux pour le travail dans ce dossier. Et pendant le futur, dans l'accord en principal, le staff travaillait dans le spécifique plan pour le futur et pour les plans de santé ici à Nouveau-Brunswick.
What's the potential timeline for? Yes, thank you. You were cocking your eyebrow at me, so I thought I'd just go for it. What's the potential timeline for at least some of these bilateral agreements to be struck and money to start to move? Like, would it be for the upcoming fiscal year?
Yes.
Yes, it would.
So we might see it reflected in the budget next month?
Yeah, from what we talked in relation to timing, it's probably something that'll come to fruition in dollars in early July. But we'll recognize that in our budget, that this money would fund, and we'll have agreements in place that would say exactly where it's going to go and what it's going to be used for.
See, Jean, one of the reasons that Jean-Yves and I are trying to see all 13 jurisdictions in the last week is precisely that, to come to these agreements in principle. I think it'll be a positive exercise here in New Brunswick. Then the province can count in its budget process on those dollars that will arrive in the next financial year. We have to put the budget through Parliament, but that normally is done before the adjournment in June, so it meets the timelines that we hope the province can appreciate in terms of being able to count on this money.
And that's in all 4 areas? Like all the agreements would be done that fast?
I would hope so, yes.
Multi-year amounts.
Well, again, Jean-Yves, perhaps, Jacques, and I don't want to, the basic bilateral agreement, which we would propose to sign with New Brunswick, is a 10-year agreement. They will identify within those 4 priority areas how they want to allocate the money based on the priorities that they determine. Those are 10-year agreements. There are some existing agreements that will also be rolled over and renewed that will expire before the end of the 10 years of these agreements. So that was the conversation. We want the province to know exactly how much incremental federal money will be available. and to be able to make the best decisions they can on how they want to allocate those dollars.
Maybe just Minister Duclos could just answer on, New Brunswick has these large surpluses the last 2 years. How do you feel about advancing more funding to New Brunswick when Mr. Higgs is running up these big surpluses?
Well, these dollars are incremental to the dollars that the province will be investing. Minister Fitch and Premier Higgs will be better able than I would be certainly to speak about the plans that they already have in supporting the healthcare needs of people in this province.
And if I might comment
please.
on that, it's been clear the discussions that these are incremental dollars, and we will have the minister has a budget that's pretty lucrative as it is in terms of what's needed in healthcare, and so we're continuing to put more money in healthcare, and so there's no issue with that. I think the banter back and forth was like, well, I can't be reducing the budget because of these incremental dollars, and there'd be no intention of doing that.
And Jacques, your question is a good one, and other premiers have raised it with us last week. The cost pressures on provinces around healthcare expenditures are enormous. So we haven't met a premier, and we saw 10 last week, Premier Higgs today and Premier King later today, and the Quebec government tomorrow. We haven't found any jurisdiction that believes or says that they can reduce their own level of spending. In fact, many are planning increases to meet the increasing demand. So I am very confident across the country that this federal money will be incremental to the very significant investments that provinces are already making and are planning to make over the coming months and years.
Quick question. How are you developing, I guess, Mr. Premier, the priorities for the action plan for the bilateral funding? Who are you going to be consulting with?
Well, certainly, I guess this probably is a better answer for the minister here.
Sure, and we have been consulting all along. It even started back with Minister Shepherd a number of years ago, and we've actually been working with Plan A and Plan B. Plan A is what we need today and what we can put forward for the budget submission. Now that with this agreement in principle, we would be able to go with Plan B, which again would show some of that incremental initiatives that would again look